Okay, let's move to our keynote for the morning. It is with really great pleasure that we welcome Associate Professor Michelle Villeneuve to deliver this morning's keynote address on person-centred emergency preparedness. Michelle works at the University of Sydney. She flew up from Sydney on Wednesday morning and did prepare a PSEP workshop with some of us on Wednesday. Michelle is the Deputy Director of the Impact Centre for Disability Research and Policy. She leads an international program of research that addresses inequities that people with disability experience in everyday living and in situations of natural hazard disaster and other emergencies. The PSEP program that Michelle is going to share with us won the National Award last year in the National Resilient Australia Awards. Well done. That was pretty special. PSEP sits, I was looking at your website this morning while I was having my breakfast, and it sits within a larger project called Leave Nobody Behind. And it struck me in fact, that's just a fabulous name for a project. So I've got a little bit of project title envy over that, I'll declare, like Mandy had yesterday. That Leave Nobody Behind really is pretty much sums up what we're all on about. So with no further ado, I'd like to ask you to join me in welcoming Michelle to the stage.
Thanks, Jenny, for that really warm welcome. And before we begin today, I would, in addition to acknowledging Aboriginal people who are here today and acknowledging Aboriginal lands on which we meet here today, I'd like to also recognize and acknowledge the Aboriginal lands across Australia that we have been doing this work on. Really pay my respects and extend that to any Aboriginal people here in the room today. I also want to acknowledge and recognize the systemic discrimination against people with disability that has a long history of institutionalization and systemic barriers that people with disability have worked really hard to overcome and who have inspired incredible change towards inclusion in all aspects of life, and who have been instrumental in this research to make sure that people and their support needs are at the center of inclusion, at the center of change, and at the center of emergency management, because they have a right to access all of the aspects of disaster risk reduction before, during, and after emergencies that all of us have the same rights to access. And on today, International Women's Day, I'd like to just put forth a commitment that my job this morning over the next 40 minutes or so is to inspire inclusion. I'm going to talk to you a bit about the PSEP toolkit today. And I want to talk about the idea that everybody needs a plan. And I mean everybody. And that means not just the people that we're supporting in the communities who we might consider as vulnerable or at risk in an emergency situation, but every one of us as an individual in our households, every organization and service provider out there. That includes our businesses where we go and interact in our daily lives in the community. And it also means our community level plans that we hear mostly about, our emergency management plans as we call them here in New South Wales. They're called different things in different jurisdictions, but essentially they're our local government and our state government plans. They need to actually be really well in place and inclusive. So before we try to inspire inclusion around emergency management, we need to make sure we do our job within ourselves to make sure that we are aware, capable, and prepared for disasters. When we are, we have the capability and the confidence to do that with other people, and it means we're much more supportive of what other people need in times of disaster. I want to start by backing up a little bit beyond person-centered emergency preparedness to disability-inclusive disaster risk reduction. what is this and why do we call this acronym DIDRR? DIDR is really about making sure people and their support needs are at the center of disaster management across, not just waiting for the disaster to happen and making sure that people hear or understand or access those warnings to take measures to be safe, but long before the disaster strikes, that we are thinking about how people get, give, receive support every day, how we provide support within our communities and across our communities, and we take those measures to make sure the needs we know people have are actually prepared and pre-planned for in emergency situations. And we'll talk about that a little bit more today, but from a human rights perspective, people with disability have the right to both protection when disasters strike, but also inclusion in that whole process. And they have a lot to teach us about the ways that we can make all of emergency management more inclusive for everybody. I want you to meet Peter and Christy. On the left of the screen is Peter, who was up here with me on Wednesday running that PSEP workshop and a disability inclusive emergency planning conversations. And I also want you to meet Christy on the left. Christy is an emergency management coordinator for her local council. This was Peter and Christy's first meeting. At the time of this meeting, Christy was really nervous to talk to Peter. And Christy was really nervous because she had never met anyone with a disability before. She'd never gone to school with anyone with a disability, and she had no one in her extended family and no one in her immediate family and no one in her friendship circles that had a disability. She, without knowing it, was othering people with disability. So instead of seeing Peter as just a person, she was seeing Peter as an advocate and a member of this disability community who uses a wheelchair and might even be a little bit frustrated and angry about, the lack of inclusion in emergency services. That's how she came to this conversation. Peter, who was also new to working on disability inclusion and disaster risk reduction, just like Christy, they're both new, they're coming to this fresh. He came to the conversation saying, I just want our group of people with disability to have a voice in this process. I don't know where the conversation's gonna go, but I wanna be part of the conversation. One of the things that was challenging is Christy first said, I'm gonna have to go to manage all our emergency management arrangements, talk to all of our people, our emergency management committee, the formal policies, the rules, and then after I get some good information from them, I will come back and then maybe we'll have a meeting with your group, your peer support group, other people with disability to talk about how we might move forward. And it was probably this moment where Peter raised his hand and said, with all due respect, Christy, if you're not going to involve me and my members from the very beginning, there's no point in us even proceeding with this conversation. And what I love about Christy's response is it was full of humility and a willingness to just start over. As she tells the tale, 18 months later, she took a whole bunch of little measures in place that made things a lot better for Peter and for his community. And she said, and I don't need to be pat on the back for any of those things because we should have been doing them all the way along and they were not difficult things to do. The one thing she did to make sure she was a learner in that space is she went to, Peter tells me, 14 months of his peer support group. She showed up to 14 group sessions so that she could learn from people who had sensory impairments, people who were deaf, people who were blind, people with cognitive deficits, people who use mobility devices. And what she did, without even knowing it, she did what a lot of you in the room do. She took a community development approach. And how does community development start? It starts with two people having a conversation and figuring out where their networks are and bringing two more friends and two more friends and two more friends until we have a room full of people all championing and using the same philosophy and the same approaches to move forward. So my research is really about this. How do we enable people with disability to take control of their own emergency preparedness planning while ensuring their rights to protection and safety are met? And in 2015, we had no roadmap for this to happen. By 2021, we had a rule book and requirements for action. And that's embedded now in Australia's disability strategy. And I think it's really important for the first time, Australia is really leading in the space to say emergency management disability inclusion needs to be there. Emergency management needs to be in our strategy for people with disability. Now, I've also got the changes that we've had in the National Disability Insurance Scheme. That's important, but I would say the strategy's more important, and that's because that's about everyone. Not everybody accesses the NDIS. Everyone accesses their communities, so the strategy is really critical. But our research all the way along has been building and embedding DIDRR into policy documents as we've taken the journey. We're not waiting to disseminate at the end, and we're not waiting to make that influence till the very end of the research process. We're doing it as we go. We started it in 2014 and a little bit earlier working with our colleagues in Asia Pacific when we were moving from the Hyogo Framework for Action, which is our international framework for disaster risk reduction, into the Sendai Framework, which started in 2015. We were championing change and disability inclusion at the highest level of ministerial meetings from that moment and moving that forward. And I've got a number of policy documents up there that are now showing that Australia is responding at a policy and a framework level to build what we've learned into practices, including, if you can spot the backward document up there, the newest released state emergency mitigation plan for New South Wales government. How did we get from an idea to all of this policy and change? It was really by working with communities and taking a knowledge to action process. In that inner funnel, what you see is this process of inquiring and synthesizing and co-producing. For us, that means reaching in to the research literature, and I have a team of people who love to conduct literature searches and work with librarians and systematically get all of that information and data from what is already published out there. I've got a great team of people who love to do that stuff. But I also have a great team of people who know that the wisdom is in the room. And so they are the team that goes out to community and talks with people. We bring that evidence from the literature and we say, how does that fit for you? Does that resonate or not? What's different? What's missing? And we bring that together in a constant process of synthesizing and co-producing to learn what people actually need to do the work they actually do on the ground in communities. What pops out the end at the bottom of that funnel are products and tools. And I'll talk mostly today about why tools you can use are a critical part of this process. The circle around just shows an appreciative inquiry process. We could spend a lot of time focusing on the challenges, but we don't. We recognize them, we understand them, but we focus on practices that work and we amplify and grow practices that are working well through appreciative inquiry cycles. And this is what's happened as a result. We've co-produced tools, probably too many at first, and now we're in a process of pruning and streamlining those into a more effective package. But I think that's great because it's meant a lot of people have had a play with a lot of these ideas, and their practices in the community have shaped and rebuilt how we articulate what those tools are and what they do. And we're not done. So make sure you visit Collaborating for Inclusion because that's our play space for all of you to access tools, sometimes tools still under construction. We're unapologetic about putting them there because we want you to feed back to us what's working, how you're using it, what does implementation look like when you put it into practice on the ground, and where are you getting stuck. We want to understand where you're getting stuck so we can work with you through more appreciative action cycles to make it work better for you in communities. So that site is regularly updated. This June, we'll be pulling together 10 years of research in Australia alone and synthesizing that work into now the framework for collaborative action. For today, I want you to understand and think about how important it is to collaborate for this to happen. No one person can do inclusive disaster risk reduction by themselves. Our LEACONs aren't going to have the answer, our state governments are not going to have the answer, and our DPOs, our disabled people's organizations, are not going to have the answer. If we continue to work in silos, we won't be able to solve the problem. So our community services and our neighborhood centers and our allied health professionals and all of those people need to come together with those groups in order to make the change that we want to see. But collaboration is really hard. So we've tried to simplify it. Think of the triangle as the collaboration and teamwork that you're doing across sectors, and the diamond on the other side is the outcomes that you're trying to achieve. You can think of yourself as having a role in this space, but you need to always be asking what other community participants need to be invited to the table. Who's missing among those community participants? What should we focus on, and why are we focusing on this in the here and now? And what do we need to focus on first, and maybe leave some other things aside so that we can actually get some runs on the board and achieve? What tools do we need to make this work? When we do that, we actually are working together toward achieving those outcomes that matter: safety, well-being, protection, and inclusion of people with disability, and everyone else in the community as a wonderful byproduct of really focusing our attention on this work. The enablers and barriers and the roles and contributions are just the stuff of life that either helps us or gets in the way. When we're doing this well with other people, we can use our roles and find workarounds, or we can say, I don't have enough time, I don't have enough energy, my manager's not supportive. We can use those things to our advantage, or we can use them as excuses to not get started. So what we want to do is really think about ways that we can help you to get started on this journey. The progression of DIDR in Australia has happened over 3 phases, and our mission as an academic team, but I would like to think in partnership with all of the groups we've been working with across the community, is to put Australia on the map as leading in this space, showing the rest of the world how to do this and how to do it really well. We have a lot of key ingredients here in Australia to make this work really effectively and to show the rest of the world how to do it and how to follow our lead. We started in 2015 by just trying to figure out what is it and how can we do it and where should we put boundaries around it to just get started. And that began by bringing different stakeholder groups together: people with disability, their friends, their allies, their caregivers, service providers who provide routine care and support every day, community service providers who provide population and community level support every day, together with government and emergency services. Peak bodies at all levels have been part of this conversation because we can't just learn in our local community. We have to filter those learnings up to the people who are making the decisions, and their decisions and their strategies and their thinking about policy needs to filter back into the conversations at the local level. So that's how we have worked on this journey all the way along. A pivotal point was really starting to think about, well, what role actually can people with disability, community organizations, and others play in the pre-planning and preparedness stage long before a disaster? What role is really going to contribute to that kind of engagement work that's really going to make people prepared before a disaster strikes? And now we're in a phase of learning together. We need to sustain the enthusiasm, the motivation, and those conversations so that we can really spread this across communities. Just trying to get this to move forward. And if you can flip the switch. Try again. Oh. Well, I'll stop here. What I have on this slide is a lot of words. The words don't really matter. The spiral is what's important. It's the negative downward spiral that actually stops us from progressing. Our research has shown, all the words on the left are things that our research with people in the communities have shown create and perpetuate a negative cycle toward more risk, less safety, less well-being, more hospitalizations for people with disability when disasters strike. Things like the perception that it's not my responsibility, this hot potato we pass to say it's someone else's job. Vulnerability thinking that says the issue is the person because they are vulnerable without realizing it's actually the ways that we're working that make people vulnerable, and it's the environments that we've created that are making people vulnerable. Competing priorities, time constraints, high staff turnover, we hear a lot. Low to moderate preparedness in ourselves and trying to inspire and motivate others is a recipe for disaster itself. Limited organizational preparedness, meaning we don't have continuity plans in place at the outset to pick up the place where rubber hits the road and people's needs aren't being met. We need your organizations to be prepared. This perception that people with disability don't have the capacity to prepare, they don't want to participate, or they don't have the ability to participate, also a recipe for disaster. Limited and ineffective coordination across sectors, because even in our government and our local governments, we work in silos. We have our disability inclusion access and we have our emergency planning, and sometimes those two just need to come together and walk across the hall to plan together. Ad hoc planning in response to imminent risks instead of pre-planning long before disasters happen, another challenge for us. Doing for people instead of with people. You can't make plans for people with disability, but we can support and facilitate people to have a plan that works for them. Interestingly, the biggest challenge we see in this process, and I think we must have just lost the battery here. The one that we actually see repeatedly is competing priorities, time constraints. That's what people talk about, but actually it's the other stuff that's really critical to making change in this process. So if we want to enable a positive spiral towards success, our research has shown how important tools are in this process. The tools we use matter because they direct how we work. They direct the questions we ask, the ways that we think, the way we interact with other people. So if we build for collaboration into the tools, that's what we'll get. If we put empowerment in the tools, that's what we'll get out the other side. You guys are a critical piece of that puzzle. The networked communications between community service providers is so critical. But your role in networking your communication networks into local government is so powerful. You guys need to be connecting with your local councils to make sure that network support and your connections to community are also linked in through council. There were questions yesterday about, how can we sit on that committee? I would turn that question into, how can you mobilize the voice of your community so that message is getting to the committee rather than having everyone around that table? Leveraging the strengths, leveraging the capabilities of everyone in your community who has different talents, different ways of organizing those talents, and different opportunities to leverage their networks. Breaking complex things into easy, stepwise procedures that everyone can take. These are the things that we build into tools so that everyone can use the same tool, a shared language, and share responsibility so that we're all actually in this together to make sure nobody is left behind. Here we are now a decade later, and through this process, I can say, here's your 5 tools of choice. This is what we want you to be focused on. Person-centered emergency preparedness, the toolkit that I'll tell you about in a second. Disability-inclusive emergency planning, which is really critical to activate conversations at a community level and get that network support happening. The person-centered emergency preparedness certificate, because it turns out tools are good, but education together and sustained conversations is even better because we help each other to use those tools in ways that make sense. And so the National Certificate Program in PSEP has been a great way to bring different people together in that process. PSEP Connect, because learning communities need to continue those conversations long after a training program is over. And ESDA, Emergency Sector Disability Awareness, because we cannot assume our colleagues in government and emergency services know about disability. They've called for training to help them understand what is disability advocacy, and what does representation really mean. And our ESDA learning modules do that. Person-centered emergency preparedness, disability-inclusive emergency planning are the sister foundational interventions, if you will, community-based interventions. PSEP starts at the individual and helps everyone to self-assess their preparedness, capabilities, and support needs, make a plan tailored to their support needs, communicated with their support network. When we start communicating it with their support network starts to go, wait a minute, we're responsible for your transportation every day. What are we going to do about that transportation when disasters happen and we've lost our access to transportation? Our organizations can start to build better service continuity that's actually responsive to the needs of the people that they support. Disability-inclusive emergency planning conversations happen in the other direction. And that's what we did here, bringing 7 local government areas together in the Northern Rivers to start the conversation at the community level. These multiple stakeholders talking about what are the things that get in the way of people being safe. Let's start the conversation and start brainstorming what are our assets and what do we bring to the table in this space. They meet in the center, and organizations like the many organizations in the room are really critical. You guys are the under-recognized glue holding all of this together, who we realize how wonderful you are when disasters strike because you self-mobilize and make things happen. And I think we need to create systems where you're actually activated long before a disaster to be part of that glue. You're going to hear from the panel a little bit today about what is the PCEP and how does it work. So I won't spend too much time on that except to say the capability framework is the language we want you to be using. We don't want you to talk about the deficits or the diagnoses or the impairments that people have. It does not help our government and emergency services to make plans. But if our government and emergency services know that the issues are around accessible communication for emergency warnings, early transportation and its mobilization, those are things that they can put into community level plans. So let's stop talking about disability as some kind of diagnosis or impairment. Let's start talking about the functional support needs that people have in all aspects of life, and the capability wheel helps you to break that down, starting with a conversation. Let's not forget there's 4 steps to emergency preparedness, and traditionally our emergency services have focused on the things that they're required to do at a legislated level. Tell us about our risks, tell us to make a plan. But for most of us, that's not enough. And our research will show that most people are insufficiently prepared. If we're insufficiently prepared, and we can look inside at ourselves today, then you can bet that people who have additional support needs are going to have a harder time getting their plans in place. Make sure you start with strengths. Start with what they do every day, where they get, give, receive, and support, and how to mobilize them as champions in their own preparedness. And that's really what the principles of PCEP are talking about. When we do this well, we naturally start to come together, because you, as service providers, are not necessarily disaster experts. And our liaison is not necessarily a disability expert. We need to bring that information together. Preparedness is a process, not a one-time event. That's the same is true for on an individual level, on an organizational level, on a community level. So don't use the tick box approach. Tick and flick is not going to make people safe, but really engaging it as a stepwise process that says, I can do better, and this is where we're at now, and this is how we can get to the next step in our preparedness. We've been developing these tools through that same action-oriented process all the way through the process for person-centered emergency preparedness, to our certificate course, to our PCEP Connect learning communities. All of that has been developed on the same philosophy and the same approach methodologically. And I really invite all of you to think about or consider the certificate course, especially where we'll still have funding to offer it for free for anyone who wants to take it. Go online and find out more. Recognize that not everybody wants to take a certificate course from the university to learn how to make a plan. So we also have a program of research that's having peer leaders lead and champion the charge. Yes, we do have people with intellectual disability planned up, aware, capable, and prepared, and leading emergency preparedness with other people with intellectual disability. They're dispelling this myth that people with cognitive impairments can't make a plan. They absolutely can, and they can absolutely support other people to get prepared as well. This is the 3-part ESDA module, also on the website. So you can have a look at Collaborating for Inclusion. I'll put the website up at the end for you. If you're in the emergency services sector, please share it. I think about 1,400 people have done these modules so far. Just like building PCEP, we built this with the emergency sector. We co-designed it with the emergency sector, we field tested it with the emergency sector, we got feedback from them, and now it sits fully accessible online for you to do at your own pace. People take the emergency sector disability awareness often before or after taking the PCEP certificate, or sometimes separately, a bit of a mix and match kind of thing. Our disability inclusive emergency planning forums, I said, was the sister intervention, the thing that starts at the community level. And I can't keep up with my map. I have to keep adding numbers to the map. From a research perspective, we analyzed data from 28 forums, over 800 participants, 235 people with disability, 28% representation of people with disability. We strive for over-representation of diverse voice of people with disability, recognizing in Australia about 15 to 18% of the population has a disability. You can look at the map to see how we're starting to expand that, and I feel a bit sorry for South Australia. I'm actually going there next month, and they're going to have their first disability inclusive emergency planning there. Council's role in hosting these forums is critical. This slide just has a whole bunch of comms and flyers, the stuff that councils are so good at and their teams can do, and the ways that councils are connected to all of you in the community is the way that they get those bums in seats to start the conversation at the community level in these DEP forums. But most importantly is what they do after. And Luke's on the panel today, and he's going to talk a little bit about what happens after a DEP forum. This is what we're seeing today in terms of a picture of that change and that change process. DIDAR is really expanding person-centered emergency thinking and approaches, which are embedded in our Sendai framework for disaster risk reduction, now embedded into our policies in Australia. But most importantly, it grew from the grassroots. It did not come policy down, it came from the grassroots up. And I think that that's the absolute power of community development approaches. When we recognize people as capable, when we build empowerment into the tools we use, and when we act with humility and just start the conversation. And I'll stop there. Thank you. I wonder if I don't know if we have time for questions or there's time. Okay. I'll open it up then to see if there's questions. I might have rushed you through. Great.
Thanks, Michelle. I'm wondering if you could talk about how different communities come to have one of those disaster inclusive emergency planning workshops and what your capacity to offer those to particular locations is.
Thank you for asking that question. You saw in that earlier slide where I talked about a co-design process for the person-centered emergency preparedness. We went in PCEP to developing the tool and trying it out in small groups to realizing, oh, we needed to kind of workshop this with communities. So we had full workshop days with all these stakeholders and providers. And they were like, oh, that's not enough. You get a lot of broken telephone because when you're in a workshop, I don't know if you know, but 10% actually stays in your head and 90% is gone after. That wasn't the way to do it. So then we had to move that into synchronous online at the same time, coming together in online environments, but doing it in a more paced way and over time. And now to the self-paced course, you can go online, your buddy can go online, and you're learning together with different stakeholders, including people with disability in that course. We are now at the stage where we have engaged the DEP, or the Disability Inclusive Emergency Planning Forum, in much the same way, but PCEP's further ahead in the race than DEP is. I believe our next steps for DEP is for us to actually continue to work with communities to develop the facilitator training so that it doesn't depend on my team to lead those forums across communities. We are willing and ready to do that in the interim, and our focus right now is on building and co-designing what that facilitator training looks like so that can now live within communities. Anticipate that will take another year or two, the same way that the PCEP process took place. We're currently working with Western Australia to focus at the community level and our plans are to work using that as a bit of a living lab in Western Australia to develop the facilitator training. So stay tuned for that and look back to Collaborating for Inclusion for those opportunities as well. And in the meantime, just reach out and ask, because it never hurts. Kate said yesterday, just reach out and ask. We love to talk to you about our research and we love when people want to use it. It never hurts to ask. I'm sure we can find a way to work together. Thanks, Megan. There's a question over here. I think there's a microphone coming down here. Eric, if you come to the 5th row or something.
Hi, thanks, Michelle. I just have a query around funding for PCEP facilitator roles. So those that are trained to be able to go out and help people in the community. And I've kind of heard there's a bit of a desire for that, that doing the facilitator training is fantastic, but then how do those facilitators assist in the community to help with that? Yep.
Yeah, I think that is an excellent question. We always design the PSET for everybody to use it from wherever they're standing. That's how it has always been designed. Your panel that's going to come next is actually going to show you how they've adapted it and embedded it into different roles in different sector work that they do and how they've made it work for them. I do think that we need to get the actual resources into the hands of more people with disability. They need to understand about this work. If you guys have access to people with disability, tell them about it, because they are amazing advocates, let me tell you. I had a colleague with disability who was part of our co-design work that we did in Victoria. And she had been involved in some of that early peer design work where we were working online together and developing the peer leadership program. It was actually a replication of the work that we'd originally done in Queensland. And Jeanette is her name. About 18 months or so had gone by since that program had ended in Victoria. And there she was finding herself now for the first time on the NDIS. And so she had a NDIS worker come into her home who brought the PSET workbook with her and left it with her. She took that moment to say, well, I was part of that program that helped to develop that. And the worker looked in disbelief that that could possibly be the case. And when they got over that, Jeanette went into advocacy mode and said, well, I've already got my plan because I was part of this process. But what is your organization doing to support everyone else that you provide services to help them get prepared? I think we need to support individuals with disability and their carers to have that agency to ask, and to have the right to ask about that, and to have the right to build it into the goals for the services that they're receiving in the community. Our PSET certificate course was really interesting. We evaluated that in terms of, did people like it? And that's great when people like a course. And then we evaluated, did they learn anything and do anything differently? That's way more important. And we're continuing to evaluate the implementation of that on the ground. One of the really exciting things about the before and after certificate evaluation was the significant impact it made on the disability service providers particularly. So that group increased their own preparedness and their own willingness and capability, like 8 times greater than anyone else in the course. Everyone increased, the disability providers went through the roof. That can tell you a couple things. One, they were starting at a much lower bar in terms of their own preparedness and their knowledge and their inclusion in this space themselves. For service providers of any type, whether you're allied health or health professional, whether you're a disability support provider, your neighborhood center, community worker, community development of any kind, you guys have also been left behind when it comes to emergency management and preparedness. So the best way for you guys to help everyone get on board is to get the activism happening at that grassroots of the individuals you're supporting and support that to happen. I think we're going to hear about other ways on the panel that it has been implemented and how people have found ways to embed that into their roles. The only last thing I think I should say about that topic, because it's related to the hot potato, our emergency sector might say, well, it's not my job, it's not my job to do disability. That's the job of NDIS providers. Be really careful about that, because so few people in the big scheme of things are actually receiving NDIS services and supports. There's a significant number of people with intellectual and developmental disabilities who are not on the NDIS who need support to make a plan and communicate that and feel confident with what they're going to do when a disaster strikes. Quite a number of people will not be able to have access if we narrow our focus to this is just about the disability sector and the NDIS scheme as a way to do that. We need to really open it up. And I think another champion in this space is our local governments. If you're not engaged with your local government and their disability inclusion access planning committees and their community interagency groups, start one up. Activate the change in partnership with your local governments to make sure you have them. Does your local government have an emergency management plan? If you search disability in that plan, is it there? What about homelessness? What about other groups in that community if you work with children and youth? Then go have a conversation and say, how can I help you to get it there? Community interagency groups are council's channel for getting the message out. It's your channel to amplify messages from the grassroots of community back into council. So activate the wonderful change that you've done with Resilient Lismore and do that on a day-to-day basis to make sure that you're channeling information in and back to your community through those roles in local government. There's legislative requirements around disability inclusion in both of these things: access planning, access to the community, emergency management planning. So leverage those and be part of that change process in partnership with your local government. Don't assume that they know how to do this. They can't do it without you. They really need your support.
Yeah, hi, is that on? Yeah, I got the microphone here, so I'll up the back corner to your right. My name's Matt Johnson. I'm the Regional Emergency Management Officer, new to the role here. Part of my role is to ensure emergency plans are in place, assess, review and exercise those plans. You spoke before in relation to the short course. Just want to know about being able to enrol in that sort of thing to help ensure that those things are in our plans. Okay, so move to the next slide and tell me that. Beautiful.
Thank you for that. I did skip a few things on there, and maybe I'll just take this opportunity to say I'll take this opportunity to say that, our journey's not over. We're still working in this space. So I mean it when I say, go to Collaborating for Inclusion, visit the website, have a play around. We're currently working to build 10 years of knowledge into our DIDR framework for action. This is going to be launched by the Australian Institute for Disaster Resilience on the 12th of June in a webinar. So look forward to that and pay attention to the comms, and we will shout it out everywhere we can so that you can attend that webinar. And ADAR will also archive that on their site so you can access it after the fact as well. There are already a series of 3 webinars in the lead up to this framework for action that are already on ADAR's website and linked to our website as well. So have a look at that. We're really excited to be able to share how this works in practice. We've broken it down as we do, just like the PSEP, into parts that you can action. We're also working with the National Emergency Management Agency to turn our attention toward the emergency sector and what can we do to build the national guidelines and standards of practice for the emergency management sector from the top all the way down, and I'd like to say from the bottom all the way up. And we'll be developing a benchmarking tool, just like we did with the PSEP, to support local governments, local emergency management planning committees to self-assess where their plans are at and how can we take that next step to make it a more inclusive emergency management plan. So definitely go to Collaborating for Inclusion, follow the links. I promise you in a few weeks we'll take all of the stuff that's been buried for research purposes and start to shine a light on it. It's right now actually being a bit reorganized for greater salience when you visit. But follow the links, and if you ever get stuck, just email us and ask us how you can be included and get involved. Really excited about the PSEP course, especially because it's the first in the world that I am aware of that has brought all of these sectors to learn together. Last May, we had people with lived experience of homelessness living out of their car and on the streets, doing the course from a local library as peer supports and advocates, learning alongside their local government counselors, service providers from the community. There's nothing more powerful than that kind of learning. Thank you.
Mine's just really quick. Michelle, mine's just really quick. Sorry.
Last question.
I just wanted to know if visually we could, like anyone in the room who's actually taken the course, so we can see visually who has, and then I know that there's one on March 11th that's starting, so I was wondering if visually we could just see who in the room is going to be in that course, just to kind of see what we've already got in the Northern Rivers. So I suppose if that's okay, could
Does
we,
anyone want to put their hand up if they've
like
taken
if you've
the
already
PSEP
taken the
certificate?
course?
And
So
anyone
there's-
who's enrolled this month or on the waiting list to get enrolled?
So I'm enrolled, but
Look at
that's
that.
good. I think that it's good to see that we do have, what was that, maybe 10 that have already taken the course in the Northern Rivers. So I just wanted to kind of visually say it's been starting. So thanks for the work.
Thank you for that. I know that you're going to hear a bit more about PSEP Connect, but our way of keeping you all connected is those with a certificate, you get the course, you get the certificate, you're done. We invite you in to PSEP Connect. That links everyone. So we have a database of everyone who's taken the PSEP course, Anyone who wants to communicate with people in, I don't know, Adelaide Hills right now is the current question, Western Australia, here in the Northern Rivers, if you want to get the word out, send us an email and we will forward that email through the listserv of all of the people in PCEP Connect, and just give any information you need in that email and we'll push it out. We can't obviously, for privacy reasons, give you their contact information, but we can share information through that network. So PCEP Connect, I think, will hopefully be a really growing way for us to make this happen across communities. Thanks for that, Laura.
It really is time for PCEP. Like, we've been talking about PCEP in our project with or particularly Ruth here has been talking PCEP with lots of services in the Northern Rivers over the last 6 months, and it just is the right time to start this conversation now. 6 months ago, a year ago, it was too early. Because of the size of what happened here and the trauma. People are not ready to think about getting prepared. But we feel like there's a sort of a barometric reading that this is the time to start. I want to thank, in the first instance, I just want to thank Michelle very much for coming up here, not just for this keynote, but for the workshop that happened on Wednesday. When Michelle said yes, she'd be happy to come up, we thought we might ask her to do another thing, as you do, and run a DEP the day before the summit, which we did. About 50 community service organisations, people with lived experience of disability, emergency services, and the Reconstruction Authority attended the workshop, and we across the whole 7 LGAs of the Northern Rivers, and we feel like this is the beginning. It was great what you just did then, because we start to see that there are already individuals who are doing this, who've done the course, but what we need to do is actually form a regional community of practice, which we are going to start doing that training. And also the Reconstruction Authority are talking about how can we actually strategise this across the Northern Rivers. So this is a ball that has started in our region, which is really, really exciting. I want to thank Michelle, therefore, not just for that keynote, but for the workshop on Wednesday, for being here for 2 days, and for supporting us here on the Northern Rivers. Big thank you.